Good evening, viewers. My name is Rahul Desai, and on behalf of FDC and Med Talks, I hereby welcome you all to this milestone in our journey of hydration in diabetes series, which we had begun taking into importance of hydration, specifically in diabetic patients. Dear viewers, we have come a long way in our journey. We started off with topic our body, the water within, then topic the endocrine of water the mega nutrient, water and health, water and diabetes. And today we will be going through the module water and diabetic complications. So before we proceed ahead, let me have the opportunity to introduce our dignitaries and the host for today's session. The host for today's session of our session is Dr. Sanjay Kalra, sir. He is the president-elect of South Asian Federation of Endocrine Societies. He has done his DM endocrinology from AIMS, New Delhi, and fellow of research of College of Physicians from Edinburgh. He is practicing as consultant at Bharati Hospital, Karnar. He is the past president of Endocrine Society of India. He is the board member of International Society of Endocrinology and president of Indian Professional Association for Transgender Health. He's the section editor of Endocrinology API Textbooks of Medicine, as well as Tropical Endocrinology Endotext PubMed Indexed Textbook. Next, and our speaker, Dr. Nitin Kapoor. He is the professor of endocrinology at Christian Medical College, Vellore. He has completed his PhD research on clinical and genetic indicators of obesity from University of Melbourne, Australia. He is conferred with prestigious AR-SET Gold Medal by Endocrine Society of India in the year 2020. He has been awarded as the youngest investigator award by Sri Lankan Endocrine Society in 2019. He's been awarded as the Melbourne Research Scholarship from the year 2016 to 2020. Then at Tamil Nadu, Dr. MJ University Gold Medal in Endocrinology 2015. A.V. Gandhi Award for Excellence in Endocrine Research in the year 2014. And the Award for Excellence in Endocrine Writing 2014 and several other awards. Dear viewers, diabetes complications often share the same risk factors, and one complication can make other complications worse. And this is our core agenda for today's topic. But before I hand the platform to our dignitaries, let me have the opportunity of announcing the names of those doctors who have answered the quiz questions correctly in the last session. And the winner is Dr. Ashirwad Pawar from Mumbai, Maharashtra. So congratulations to the winner. Next. Dear viewers, we started off this financial year with a very big event where Dr. Vivian Fonseca addressed the audience on scientific approach in improving the vascular and metabolic health in diabetes. If any of the viewers has missed to attend this session is available in the same platform in the archive section. So don't miss this opportunity to go through the session. And with this, I hand the platform to Sanjay Kalra, sir. Sir, over to you.
Thank you, Rahul, and good evening, everybody. Good evening to everyone from across the country. And I acknowledge people who've already logged in, people who've already begun asking questions. So, salam, Dr. Afaq Khan. We are on this journey of learning about water, something so simple. We tend to take it for granted, but something that is essential for life. Without water, none of us will exist. We've had many webinars. The last one was on diabetes and water. And we learned how water actually can be used as primary and secondary prevention for diabetes. Dr. Atul Dhingda was our guest last week. Let's continue the discussion this week with Professor Nitin Kapoor from Christian Medical College, Vellore. He'll be speaking to us about diabetes and complications, about how we can use diabetes, how we can use water, not only for primary and secondary prevention of diabetes, but also for tertiary prevention. How we should use water judiciously in various complications of diabetes to prevent them, to manage them. So, Dr. Nitin, warm welcome to this program.
Thank you so much, sir. It's a pleasure to share the stage with you and talk on this very interesting topic.
So, before we begin, it's so hot these days across India. There's this heat wave going on. How much water do you drink in a day?
Right. So I make sure that I drink about 2 liters minimum water. I stay in AC for most of the time, so I think that's okay. But for people who are outside or trainees who are working in wards where air condition may not be there, I think 2.5 liters would be good. But I personally make sure I drink 2 liters for sure.
Thank you. So, Dr. Nitin, the stage is yours.
Thank you. Thank you so much, sir. And may I request my slides to be projected? Right. So I will take you through this very brief presentation where I'll take you as to how water is important with respect to preventing or managing complications in a patient who already has diabetes. And if you can confirm my slides are moving. Okay, so I presume they are moving. And then I think water is essential for life. As Dr. Kalra mentioned, we talk of water with respect to diabetes when we say water based exercises, especially in people who have obesity. We tell them, swimming is better because you wouldn't hurt your knees if you're running or jogging. We talk of water, and there are studies from Japan which talk about importance of having a hot water bath in people with diabetes and how that can have an impact on glycemic control. But today, we are going to concentrate on the topic as to how water intake can help in prevention of complications. And I think this is a very simple slide where you understand how water intake is really, really important when you talk of diabetic complication prevention. Now, in this slide, we see that if somebody does not drink adequate water, it leads on to stress. Now, I'll say in simple words, I think all of us would agree that there's enough and more literature that stress can worsen diabetes and its complications. But how does drinking less water lead on to stress? And you see in this slide, obviously, whenever we drink less water, our body's homeostatic mechanisms, our body's mechanisms from the pituitary gland would start working and reduce the production of the antidiuretic hormone. So when we are drinking less water, this hormone is going to reduce. It's going to prevent, this hormone is going to prevent any kind of water loss or polyuria. Now, what happens when the ADH levels change or the ADH levels increase? CRH also increase, corticotropin releasing hormone, which in turn acts on the pituitary gland to increase the ACTH. ACTH in turn increases the cortisol production, and cortisol, all of us we have learned in our first medical year, cortisol is a hormone, a stress hormone for the three F's, the fight, fright, and flight. So that's how we connect water with stress. So if somebody is not drinking adequate amount of water, the body's mechanisms would look into that and thereby produce more ADH in a way to preserve the water that is already there in the body, will reduce the urine output. But in the bargain, we know that ADH has another important hormone which works side by side. It stimulates CRH. The CRH goes to the pituitary, stimulates ACTH, and therefore there is increased cortisol production from the adrenal gland. And cortisol, as you see in this diagram, whenever there's more cortisol, it increases the insulin. It is a counter-regulatory hormone, increases glucagon, increases gluconeogenesis, glycogenolysis, and ultimately increases the glycemic level. Not only this, we also know that whenever ADH is secreted in higher quantities, it also releases another hormone called the copeptin. And this copeptin has shown directly to act at the level of the pancreas and at the level of liver, thereby making this whole problem more complex and increasing the glucose levels. So overall, different studies have shown that drinking less water, not only increases the probability of developing diabetes, but overall uh, leads on to poor glycemic control. And if this is continued for a long time, can lead on to complications. Let's look at one study. And this is a study, this was published last year in February and in Journal of Diabetes and Metabolic Disorders. And what they have studied in this particular article is that if we increase the pre-meal water intake by 1 liter, it's a randomized control trial. In this, they have given extra 1 liter water to a group of people with diabetes and have not given that extra 1 liter, the standard, what we all follow, to another group. And it's very clearly shown that it does not only have impact in reducing the glucose levels, but also the cholesterol levels, also the body weight, BMI, even waist circumference, and also copeptin levels. So we see that overall, increasing water in a randomized controlled trial recently published has shown to not only reduce glucose but even cholesterol and other metabolic markers. So there is evidence to support what we are talking. And yes, hydration is important in diabetes. It's not only for just the glucose levels, but overall improving the plasma volume, improving the osmolarity of the blood, ultimately leads on to reduced glucose, also reduced blood pressure, also reduced cholesterol, and ultimately the cardiometabolic risk, the cardiovascular risk comes down. So that's one important thing that we learned. Hydration not only reduces the glucose levels, but also the associated cardiometabolic risk. And this is predominantly rooted through the cortisol axis. Let's look at another important point. When we have a patient with diabetes and we talk of different ways in which water can affect, and the other important aspect is drugs. We all know that we prescribe a lot of anti-diabetic agents. There are more than 8 different classes of drugs that are available today in the market, in the Indian market as well. And how does water play an important role? When we look at so many CVOT trials that have been done, the two classes of drugs that actually stand out from all the other drugs are SGLT2 inhibitors and GLP-1 analogs. I know they are expensive, but these are the drugs that provide some kind of cardiovascular benefit. SGLT2 inhibitors mainly work by producing glycosuria. They increase the amount of glucose that is excreted by the urine. Well, very well and good. It's important. It helps to reduce the sodium. It's very good for the vasculature. But what is the side effect? When there's large amount of glucose which is present in the urinary bladder, that would be a source of infection. And if my patient is not voiding frequently, is not drinking adequate water, that glucose will be very concentrated in the urinary bladder, a very good menu for a bacteria to strive on and leads on to recurrent urinary tract infection. So whenever in my practice I prescribe an SGLT2 inhibitor, the three instructions I will always give to my patient: drink a lot of water, void frequency, avoid to hold the urine for a long time. Just make sure that every 2 to 3 hours you go and pass urine. And third, very important point, it is to maintain genital hygiene. So we see that water is not only important to prevent diabetes complications, it is also important when we prescribe drugs. What about GLP-1 analogs? And very recently, last month, the semaglutide, the oral semaglutide, has been launched in the market, and yeah, some of us would have used it. So what has that got to do with water? I think the most important instruction if you're prescribing this drug is that the patient should take this drug on empty stomach with just a sip of water. Usually we tend to say, okay, it's good to drink a lot of water when you take tablets because that will get absorbed, that will get washed out. But just 120 ml of water is what is required when you take semaglutide. And that's a very important message. If you take a lot of water, this drug will not remain in the stomach, will not get absorbed, and the 300 rupee tablet will actually go waste. So we're learning that water is important also in terms of prescription of anti-diabetic agents. What about water with respect to complications of diabetes? Talking about liver disease, talking about kidney disease, and talking about heart disease. Let's talk about heart failure first. And I think all of us are well aware that patients with diabetes are at more risk of developing heart failure. If you look at studies, the odds ratio is as high as 2.5 times, which means in simple words that a patient with diabetes would have 2.5 times more risk of developing heart failure than somebody who's not a diabetic. And we know it can lead to pulmonary edema, right heart failure, and which can go down, if it's severe, also down to the legs and peripheral edema. And irrespective of the kind of ejection fraction, we can have heart failure with a reduced ejection fraction that is marked in red, or heart failure with normal ejection fraction, ultimately it does leads on to kind of an increased backward pressure, and to an extent our lymphatics can handle it, but either in the setting of an acute myocardial infarction or a chronic increase in intravascular hydrostatic pressure, we see that it can lead on to pulmonary edema, it can lead on to peripheral edema, and ultimately that causes problems. Talking about fluid restriction in heart failure, yes, it is very, very important. It is important to counsel the patients to drink smaller, frequent, volumes of water. Always keep a smaller glass rather than drinking from a whole big bottle. The average recommendation would be around 30 ml per kg per day. It's important to counsel the patient about restricted water intake because at one side you're giving a lot of diuretics, on the other side you don't want the patient to drink a lot of water. The importance of restriction of salt is also equally important. What about renal disease? And diabetes, is the most common cause of chronic kidney disease globally. If you walk into a dialysis unit anywhere in India, in any hospital, 8 out of 10 patients would be having dialysis because of diabetes related CKD. So, yes, diabetes is associated with renal disease. And when we learn about renal disease, there's a huge spectrum that we're talking about. There's a small spectrum of acute renal failure that may happen in patients who have dehydration. There may be patients who have chronic kidney disease ranging from stage 1 to stage 4. And there would be the far end of the spectrum where these patients are having stage 5 CKD, wherein they need renal replacement therapy. Well, the importance of water in all the three stages is different. We all know that acute renal failure, where there is acute dehydration, we have to give a lot of water. In diabetes practice, we see patients with diabetic ketoacidosis. And what we are taught is as soon as the patient comes to the emergency, we ask the intern to just squeeze in that much amount of saline as the first fluid because we know there is so much of water deficit. When you talk of end stage renal disease, we're trying to restrict water. The patient is probably doing dialysis twice or thrice a week, and I don't want the patient to develop any water retention or pulmonary edema a day before the dialysis, and though I would restrict water there. But what about the stages in between, stage 2, stage 3? And there are enough and more studies, as you see on this slide, where they have advised that drinking extra water during that time in stage 2, 3, and 4, or up to stage 3 for sure, you will probably provide some benefit in terms of renal function in these patients. So yes, in renal patients also in stages up to stage 3 CKD, drinking water is helpful. Obviously, acute renal failure, the hydration is very important. And a very practical tip in clinical practice, sometimes you see these patients who are not really into fluoride decay. They miss their insulin for a week. They have glucose values about 400. Ketones are trace positive, but the patient is otherwise not acidotic. So I don't call this as diabetic ketoacidosis. I say this is diabetic ketosis. And yes, I get back on the insulin. Sometimes, if I can follow up these patients on OPD basis, the most important instruction that will prevent worsening of ketosis is drinking a lot of water. And that is something which is important. Talking about fluid intake in liver conditions, yes, we know that in patients with liver disease, again, there is a third space loss, and these patients are very edematous, but the intravascular volume is very low. Salt restriction is important, but in early stages, and when we connect diabetes with liver disease, I think the disease that comes to our mind is NAFLD, non-alcoholic fatty liver disease. And in that case, again, there is evidence to suggest that if we use plain water as an intake, it is shown to reduce the amount of NAFLD, reduce the prevalence or incidence of NAFLD. And the main reason why this happens is, again, going back to our first slide where I talked about how the water is related to cortisol and how water has shown to reduce weight. The paper that I showed you, which was published in February 2021, a randomized controlled trial wherein they gave just 1 liter extra water to patients with diabetes in a randomized fashion, showed weight loss, showed waist circumference loss in patients who have diabetes. And therefore, obviously, anybody who's going to lose weight, going to have a reduction in waist circumference, will also have improvement in NAFLD. Fluid intake in acute infections, another very, very important point. We've just seen the COVID pandemic. one wave, two wave, three, fourth, we don't know. But yes, any acute respiratory infection, it's important to ask that patient to be hydrated. Many times these patients have high fever, and therefore we want them to replace the water that is lost because of the fever. It's important to treat that dehydration. It's also important, they're sometimes losing a lot of mucus, and if they are dehydrated, it would be a very thick mucus, which is very difficult to excrete. And therefore, again, drinking water is helpful in acute viral infections. So, cutting a long story short, I think what we've learned in this small presentation is yes, water has many roles in diabetes. We've talked about water based exercises, the importance of hot water bath. But what is also very important is water intake. We talk in people who already have diabetes, we can improve the glycemic control, the weight, the waist circumference. We saw the mechanisms, how it works through the cortisol axis, and this is important. The second important message that we learned from this talk was about the importance of using drugs in terms of water connection. Patients with SGLT2 inhibitors, the three instructions that we would always prescribe them along with the drug, and one of them is increased water intake. And absolutely opposite recommendation when we prescribe oral semaglutide. We talked about the importance of water in patients with heart failure, whether it is with preserved ejection fraction or reduced ejection fraction. Yes, they are prone to develop edema, and water and salt has to be restricted. We also talked about the importance of patients with diabetes who develop CKD. We talked about the different spectrum of renal disease, how water intake is very important in acute renal failure in patients who have DKA or just diabetic ketosis. Water is important, but we also talked about the importance of water in early stages of CKD and importance of restricting water in end-stage renal disease. We talked about the importance of water, weight reduction, and NAFLD reduction prevalence in patients with diabetes. Yes, it's important to supplement oral fluids. It's important to carefully monitor that. Up to 1.5 to 2.5 liters of water is recommended for most people. In those who are having an enteral feed, free water has to be provided separately, and various liquids are available for water intake. Yes, we have to be careful about calories, we have to be careful about carbohydrates, but we have to provide the fluids. So, with this, I think I come to an end of my presentation. The key message is that yes, hydration is not only important for primary prevention, secondary prevention, but even for prevention of complications of diabetes. I will stop here and maybe take the quiz questions towards the end.
Thank you, Dr. Nitin. A great presentation, a masterly presentation. And that tells us why you're professor of endocrinology, and it also tells us why you've recently become section editor of the section on obesity in the prestigious textbook Endotext. Dr.
Thank you.
Nitin, does water intake have any link with obesity, with weight gain?
Yes, sir. And that's the first study that I showed where a randomized control trial in people with diabetes, they have given 1 liter extra water before meal per day. And they've shown reduction not only in weight, but also waist circumference. And this may be mediated through the cortisol copeptin axis, maybe mediated through satiety, just because of, the gastric dilation and the production of ghrelin. But yes, it has been associated with weight loss.
So, drinking adequate amount of water before meals, not after meals, that actually may help you reduce your glucose levels and also your weight and waist. A question coming in from Dr. Afaq Khan, and that is, uh, can a person take sweet water, if he or she has type 2 diabetes?
Right. So sweet water depends the sweetness has come from where. If the sweetness has come from glucose, sugar, sucrose, the answer is no. But if the sweetness has come from sweeteners, artificial sweeteners, yes, occasionally you can take it. Products like saccharin, sucralose can provide sweetness without increasing your glucose.
And he continues with this question. And now people speak about diabetes reversal, diabetes cure, diabetes remission. What is the correct terminology, and what is the status of cure or reversal of type 2 diabetes?
So yes, This was initial work which was from the UK by Professor Roy Taylor in Cambridge, which showed that very strict diet, very calorie restricted diet could reduce diabetes, actually reverse it to normal in those people who have early stages of diabetes, who have obesity and are able to successfully lose weight by very low calorie diet. Yes, the follow up data right now is only for 2 years, and we're not sure how long the maintenance of this reversal would be. But yes, definitely temporarily it could help in reversing the pattern of diabetes. So, yes, very strict calorie restriction can help to reduce, reverse, or even cure diabetes.
With this, perhaps, Dr. Nitin, we can go on to the quiz questions for today.
Right. Can I have the presentation back again? Or maybe if I have to share it.
So every time we ask two questions, and the winner gets a gift hamper from Enerzel. In summer months, we have to be mindful of not only fluid balance but also electrolyte balance. So, in your OPD, if someone comes complaining of asthenia, energy, listlessness, increased thirst, then you have a wide range of energy drinks to choose from. For people with diabetes, you can use a zero calorie drink like Enerzel Zero. And for those with mild levels of hyperglycemia, where you just want to raise the glucose slightly, then Enerzel Blitz is a good choice. It contains just one third the calories that Coca-Cola or Limca have. And of course, if someone is hypoglycemic or someone is non-diabetic, then Enerzel is a good way to go. There are different flavors also, and that also helps the patient choose what he or she wants. We'll go on with the questions, Dr. Nathan.
Yeah, so the first question for the quiz is that when we recommend increased fluid intake, uh, are we really justified to do this recommendation in patients who have acute respiratory infections? Does it really improve the duration and the severity of symptoms? So, people who have acute respiratory infections, COVID being a very recent example, does recommending increased intake of fluids improve severity and duration of symptoms? Answer could be A, true, B, false. The second question, it's a bit long question with long statements. You have to identify the correct statement. So, high water intake, does it lower body weight, reduce total energy intake, increase fat oxidation, and energy consumption? Or high water intake has no effect on body weight, increased total energy intake, increased fat oxidation, and energy consumption? Does high amount of water intake, increased body weight, reduced total energy intake, and increased fat oxidation and energy consumption? Or the last option is high pure water intake, does it increase body weight, total energy intake, fat oxidation, and energy consumption? So there's subtle changes in these terms. You have to identify which of these statements is true. So that's with the quiz.
We look forward to your answers. In the meantime, another question, Dr. Nitin, from Dr. Shashi Khare. Fluid with electrolytes can be taken. So, can you think of any indications where uh, different types of electrolytes are required, and any indications, any endocrine diagnosis which can occur when patients present with specific likes and dislikes? Maybe someone coming with a like for cold water, for clear water, for hot water. Somebody says, I am just thirsty for salty water. Any things that come to your mind?
Absolutely. So these are very, very important symptoms and they give a clinch to the diagnosis. Somebody asking for preference for cold water is often a diagnosis which deals with another type of diabetes called diabetes insipidus. And these patients would have preference for drinking a lot of cold water. And many times you would see they would be carrying huge cans of water whenever they're traveling, very often disturbed because they have to use the washroom, they have to go for frequent urination. At times, patients are craving for salt and salty water, and that could be another condition wherein there is cortisol deficiency. Not only salty water, but salt craving in diseases like congenital adrenal hyperplasia, where young children may have this symptom. and that could be the other extreme. So, yes, there are certain endocrine disorders where patients do have all of these specific symptoms. But coming to Dr. Khare's question about fluid with electrolyte, yes, at times it is helpful, especially in those who are dehydrated, especially after diarrhea, voluminous diarrhea. I think this is something which is very, very important. ORS is something that is commonly prescribed, but yes, there are other more advanced fluids with electrolytes, as Dr. Kalra had mentioned.
So thanks, Dr. Nitin, for clarifying that. And thanks also for sharing this insight from bedside medicine or OPD medicine. If someone says he or she is thirsty, just ask about what they are thirsty for. Of course, now that reminds me of one of my best friends from New Delhi who is always a thirsty crow when we meet for dinner meetings, but then that is a separate matter. He will have a long life. So, with this, thank you for being with us. We'll come back to you with the last of our series on hydration and health. And then, after this is over, we'll have another series of lectures for you. This will be more interactive rather than didactic, and we'll be speaking about coaching and health. So we hope to start that series also in the coming months. I'd like to thank you once again, Dr. Nitin. Thanks to everybody for their participation. And back to Team FDC.
Sir, I think it was one of the best sessions we had in the series because we got two genius endocrinologists from India, one Dr. Sanjay Kalra taking the moderation part as well as the interviewing, and mastery presentation and explanation, almost completing entire preview of diabetes and hydration by Dr. Nitin Kapoor. With this, sir, we come to the end of the day and we thank Dr. Sanjay Kalra and Dr. Nitin Kapoor for being with us. Good night. Jai Hind.
Jai Hind.
Good night. Jai Hind. Bye bye.